Alright. Hi, my name is Glenn. And you're
John.
okay. I'm gonna be your nurse practitioner today, provider today, okay? We're gonna take a listen to your heart and lungs, and I'm gonna ask you some history questions, and then I'm gonna assess the front of your chest, back of your chest, then we'll have you lay down and I'll assess your heart, okay?
Okay.
Do you have any medical history with your cardiovascular system?
Nope.
No? Okay. Any chest pain currently?
Mm-mm.
Any dizziness?
No.
Shortness of breath? Okay. How about any medical history with your heart or lungs?
No.
No? Okay. No hypertension?
Mm-mm.
Sleep apnea?
I've had sleep apnea for the last 10 years or so.
Okay. Do you take anything? Do you do anything? Do you have a
CPAP.
mask? Okay.
Yeah.
And you're able to sleep well with it?
Mm-hmm.
No issues with it?
Right.
All right. So first things first, I'm gonna put some gloves on here, okay? And then I'm gonna take a look at your skin, assess it for pallor and things like that, okay?
All right.
So skin looks good. It's not blue or cyanotic or anything like that, okay? Now, have you ever had any tenderness in your chest?
Nope.
Okay. Okay. No pain or anything like that? Okay. I'm going to take a listen to the front of you, okay?
All right.
Now, I'm going to take a listen. Just nice deep breath in and out, okay? And out. Okay. All right, so we're going to take a listen to your posterior now, and we'll get you all situated so we can show people. So now we're going to assess the posterior portion of your back, okay? So an assessment of your thoracic cage, it looks to be normal diameter. You don't have a curvature of your spine or anything like that, okay? So I'll have a couple portions where I'm going to palpate, and then I'm going to have a couple portions where I'll listen to you, okay? So if you have any questions or anything as you go through, just let me know, okay?
Okay.
So I want you to take a nice good deep breath in and out. And out. And in. And out. Okay. Good. So you have normal expansion, okay? So that means that each side rises appropriately. You don't have one that is paradoxical or rising outside of another, okay? And if you had one that didn't rise, you'd worry about a collapse lung or something like that. So next I'm gonna kind of take a nice little percussion here. So I'm gonna tap you and listen for the sounds. We wanna kind of avoid your scapula, because over bone it won't make the same noise, okay? Good. So everything over that is resonant, so that means that there's air traveling through there. If it was dull or made any noise like that, you'd think that there was maybe either fluid or something like a tumor or something in there where noise couldn't travel through it as well, okay? So now I'm gonna palpate what's called tactile frontispiece. I want you to say 99 for me.
99.
Okay? Okay.
99.
Okay.
99.
Okay, good. So you have positive tactile frontispiece. That means that I can feel it when you're saying 99. Again, if you had really no feeling there, then you'd worry that there isn't air traveling through, or if you had really increased hearing there, you'd worry that there's some medium that the sound's going over, okay? So now I'm going to take a listen to you, and then we're going to, I'm going to have you take a nice deep breath in and out at each spot, and then I'm going to ask you to say the letter E. Listen for a goffing, okay? So nice deep breath in and out. And out. Can you say E?
E.
Deep breath in and out. E.
E.
Deep breath in and out. again. Good. And E.
E.
And in and out. And E.
E.
Oh, look some lateral sides. And E.
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 Okay. Alright, last thing we're going to do is we're going to assess your costophrenic angle tenderness, okay? So your lungs sounded clear throughout there, and the reason we say E is that you should get a muffled noise there. If I had like a nasally, like A, like that, then that could indicate that you have some fluid or something like that there, okay? So we're going to get down to where your spine, just below your 12th rib, so that angle that draws right here, okay? I'm going to palpate, and then I'm going to... Any pain?
No.
Okay. Alright. Any pain?
No.
Okay. So, alright. So now we'll move on to examining your heart. I'll have you lay down. So lastly, we're going to do an examination of your heart, kind of your valves and heart tones and things like that, okay? So, first I'm going to take a look and see if you've got any pulsations or anything like that noted in your precordium. I don't see any, so it looks okay. Next, I'm going to assess your, what's called your PMI, it's your point of maximal impulse, okay? So, it can be harder to find if someone's a bit larger, but usually it's right down here, just outside your midclavicular line here. Yours appears to be about 1 centimeter, so that's good. If it was greater than 1 centimeter, you'd worry that you'd have enlargement of the left side of your heart. Okay, that's called ventricular hypertrophy. So now, so I've got a cardiac stethoscope, so the bell's built into it. So when I push down harder, that's listening with the bell, and then lighter's the diaphragm. So we've got 5 points on our heart we listen to. At your second intercostal space on the right side is your aortic point. Second intercostal space on the left side is pulmonic. Third intercostal space on your left side, left border of your sternum, is your Erb's point. Fourth intercostal space is your tricuspid valve, so that the tricuspid and pulmonic valves are on the right side of your heart, and then your aortic and mitral valves are actually on the left side of your heart. Okay? So I'm going to take a listen to each area with the diaphragm and the bell. It might take me just a bit. And then after that, once I get over here, I'm going to take a listen to your apical pulse, see how it sounds, and then see, kind of tell you how your rhythm is and things like that, okay? Okay, so this is your aortic point. You can take a deep breath in and hold it. And breathe. Take a deep breath in, hold it. And breathe. Hold. And breathe. Deep breath in. Hold. And breathe. Deep breath in. And breathe. Okay. All right. So now I'm going to listen to you with the bell portion. Same 5 spots, okay? So I'll have you take a nice deep breath in and hold it after I tell you, okay? And breathe. You can breathe. Deep breath in. breathe. And breathe. Breathe in. And breathe. Last one. And breathe. Okay. So you had normal heart sounds, so that's one, that's two. So if you had extra heart sounds, that could indicate if you had extra fluid on your heart or extra fluid around your heart. If you had rubs or anything, it could indicate inflammation in your heart. Okay. So lastly, I'm going to take a listen to your apical pulse and into a nice rhythm for you. Okay. All right. Okay. Got a normal rate and rhythm. Apical pulse is nice and strong. Didn't hear anything really abnormal. Okay. Are there any questions you have for me about exam or anything else I could explain to you?
Not right now, thank you.
Okay. Appreciate your time. Thanks.